Hi, good afternoon, and welcome to Move Your Way, the Physical Activity Guidelines in Action, a webinar from the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. I'm Paul Reed, the Deputy Assistant Secretary for Health and Director of ODPHP. Our team is delighted to be bringing you this webinar today and to share the Move Your Way campaign with all of you. I imagine many of you joining today are here because you know the benefits of physical activity, both those immediate effects like improved sleep and mood, and the more sustained impacts on chronic disease like diabetes, cancer, and cardiovascular disease. Yet despite the numerous benefits we know to be true from being more active, not nearly enough Americans are meeting the recommendations in the physical activity guidelines. Getting more Americans moving will require all our efforts across diverse sectors of government and society, including particularly to the topic of today's discussion, the area of health communications. That's why HHS developed the Move Your Way communications campaign. We believe Move Your Way plays a crucial role educating the public about physical activity and promoting physical activity as something that anyone in any body can do and even enjoy. Today, we'll share details about the campaign and review existing resources available to help you implement the campaign as part of your own local physical activity initiatives. The next slide, please. In addition to hearing from members of our team, you'll also hear from the experiences and expertise of several of the local community organizations that ODPHP has collaborated with over the last 4 years. I want to take a moment to thank our speakers, Marcel, Mindy Meacham, Michelle Lewis, and Mary Kay Crawford, for not only joining us today, but also for all their efforts integrating Move Your Way into their local physical activity promotion efforts. I'd also like to thank all the other community pilot lead organizations for Move Your Way highlighted on the slide you see here. And although we didn't have time for everyone to present today, these organizations have been vital to the campaign's growth and success. And the Move Your Way campaign overall, and resources like the Community Playbook, which you'll hear more about later, simply could not have come together as well as they have without the dedication and creativity of these partnering organizations and individuals. So thanks again for joining us today. And with that, I'll turn it over to Kate Olskamp from the Office of Disease Prevention and Health Promotion, who'll get us started.
Thanks for kicking us off, Rear Admiral Reed. Before I dive into an overview of the campaign, I want to cover a few housekeeping items. I'll note that the webinar is being recorded and will be made available for viewing on health.gov after the session today. I also wanted to share that we'll be having a question and answer session at the end of the webinar. So feel free to use the Q&A feature at the bottom of your screen to submit questions throughout the webinar, and we'll be sure to answer them at the end. So first, I'd like to introduce the scientific and the policy foundation that's at the heart of the Move Your Way campaign, the Physical Activity Guidelines for Americans. So the Physical Activity Guidelines for Americans provides evidence-based recommendations for Americans ages 3 and older about how physical activity can help support their health. It also serves as the basis for the greater majority of our federal physical activity programs throughout the federal government. The guidelines is developed through a scientifically rigorous process and is written for an audience of health professionals, policymakers, and educators, which is likely many of you participating today. So the fact that the guidelines is developed for this audience means that individuals and organizations like you who are promoting physical activity in your communities were left to do a lot of the translation for consumers on your own. And so that's why early in the development of the second edition of the Physical Activity Guidelines, leaders in the field, both inside and outside the federal government, recognize the need to develop a consistent brand and message for communicating the guidelines to consumers and everyday Americans. And so it was this idea that planted the seed that eventually became the Move Your Way campaign, which launched alongside the second edition of the guidelines in 2018. The Move Your Way campaign translates those physical activity guidelines into easy to use information that everyone can understand. No matter age, ability, health status, or fitness level, anyone can use this information. Move Your Way aims to reach people who are not currently meeting the guidelines, but are thinking about making a change and becoming more active. And we call these individuals physical activity contemplators. And so the campaign aims to help people live healthier lives through increased physical activity. and help people understand how much physical activity they need to be healthy and how to fit it into their everyday life. Ultimately, the goals of the campaign are to raise awareness and knowledge of the recommendations in the guidelines, but also to build self-efficacy related to physical activity and overcoming common barriers. It's also to shift behavior by motivating people to get moving. And so research shows that when many Americans imagine physical activity, they tend to think of very vigorous intensity activities that happen in specific settings or that require specialized equipment. And for some people, maybe even you on the call today, reaching the guidelines might look a lot like what's represented on the screen. But it's important to remember that it's not the only way to meet the guidelines. For many physical activity contemplators or people who aren't very active right now, these types of interpretations of physical activity can be especially intimidating and sometimes even prevent them from taking small steps towards a more active lifestyle. The science surrounding physical activity shows us that what counts as physical activity is actually much more broad and inclusive. Physical activity includes all sorts of things, from activities that we enjoy to things that are already part of our everyday life, like cleaning the house or walking the dog. And so promoting physical activity in these diverse and accessible ways, especially to the contemplator audience, can really help to build self-efficacy and to help understand the importance of finding their own way to move. And this is exactly what the Move Your Way campaign strives to do. To accomplish campaign goals, Move Your Way is changing the conversation about physical activity. The campaign communicates about physical activity in ways that research suggests helps people feel more confident and interested in getting active. So rather than portraying physical activity as very vigorous or setting specific, the Move Your Way campaign emphasizes that physical activity can be fun, it can be personalized, and it can fit into our everyday lives. Specifically, the campaign is using messages like lots of things count, it all adds up, and find what works for you. The campaign also emphasizes that short-term benefits that people experience with being physically active. And the reason that we do that is because research shows that these types of benefits are much more likely to influence behavior than distant or long-term health outcomes. So for adults, the campaign highlights the fact that physical activity can help boost mood or improve sleep. For kids, we emphasize that moving can boost energy, self-confidence, stress, and cognitive function. Research is at the foundation of Move Your Way. So in addition to pulling from the guidelines and existing peer-reviewed literature about physical activity and communication and behavior change, all of the campaign messages, materials, and graphics are user tested throughout the development of the materials. So over the years, we've collected data from over 7,000 study participants, and we've done this through focus groups and in-depth interviews and also online surveys. And the information we gathered from folks about their physical activity knowledge, behaviors, attitudes, beliefs, information needs, and their reactions to campaign materials have really helped us to develop, test, and refine the materials so that they speak to diverse audiences and are both informative and also motivational. And our process is cyclical. So each time we develop new resources, we conduct research with our goal audience and keep the audience at the center of all of our decisions. Sorry. Most broadly, Move Your Way's audience is physical activity contemplators, which I've mentioned. To ensure that the campaign is highlighting benefits, activities, and the recommendations that are most important to specific individuals, the campaign resources further divide contemplators into different demographic groups. So we have resources for kids and teens, adults, parents, people during and after pregnancy, older adults, and then professionals like healthcare providers. Because we know that physical activity benefits everyone, across audiences in the campaign, we focus on accessibility and diversity. And so the campaign includes representations of people with a variety of racial and ethnic backgrounds, physical and developmental abilities, and body sizes getting active. In total, the Move Your Way campaign includes over 80 free resources available in both English and Spanish on health.gov. On this slide, you'll see a selection of the campaign's posters and fact sheets. Anyone, whether you're a community organization, a health department, an educator, a healthcare provider, you can download, share, distribute these campaign resources to people in your community. Additional customization of the campaign resources can be done through the CDC State and Community Health Media Center, and I'll talk about that a little bit more later. Several of the Move Your Way resources have won awards for outstanding clear communication and digital health products. And so that means you know that when you're using the Move Your Way resources, you can be confident that you're sharing clear, user-centered, evidence-based information with the people you're trying to reach. We also have a variety of social media messages. These can be used as is or cut and paste and modified to adjust. So we have both the images on the screen and then also messages that go with them. And these can be used to promote local activities or resources or just physical activity more generally. All of our campaign videos can be found on ODPHP's YouTube page and easily embedded into presentations like we did earlier today if you were able to join us at 1:30, but also in social media or within your website. And from all of the Move Your Way materials, people are directed to learn more by visiting a website that's built just for consumers. So this is a great place for people to go to find easy to understand materials and interactive tools. So we have an activity planner and an interactive tool, and both of these things let people explore different activities and build a plan to hit either daily for kids or weekly for adults goals for how to get more active. So now that we've learned what Move Your Way is, let's see it in action. The Move Your Way campaign relies on something called the community-based implementation strategy. This strategy emerged from our formative research findings, and those findings identified a place-based approach as a promising method for reaching physical activity contemplators and increasing physical activity. And so through this strategy, individuals or organizations plan, execute, and evaluate implementation activities that best align with their community resources and their audience needs. And so it's key that community members are part of the campaign at every level and help to share the campaign's messages with other members of their community. Between 2019 and 2021, HHS piloted the campaign and implementation strategies within communities across the US. And each year, we built on the lessons learned from the year before. In our first year, we collaborated with 2 local health departments to test out this community-based strategy and develop an implementation guide called the Move Your Way Community Playbook. In the following year, in 2020, we worked with a larger number of communities and types of organizations to use and evaluate that community playbook we had developed. And during our third year of the pilot, participating communities each focused on a different priority audience. So some communities focused on older adults or teens, people during and after pregnancy, others focused on Spanish-speaking individuals. So what did all of these communities have in common? All of the participating communities were located in areas that experienced low levels of physical activity. And that was especially important because it helped us reach that physical activity contemplator audience. In each community, HHS collaborated with a lead organization, many of whom you'll hear from momentarily. And sometimes the lead organization was a health department or a recreation and parks agency. Other times it was a healthcare organization or a physical activity nonprofit. And all of the participating communities were really, really creative in how they adapted and implemented the campaign. So I'm excited you'll get to hear from them in a minute. So what does implementation look like? What did these communities actually do? There is a variety of activities and they varied across communities based on that community's needs. But they included things like built environment initiatives, community events, physical activity programming. And by creating these opportunities for community members to participate in new spaces, events, and programs, the lead organization was helping to introduce new and fun ways that people can get active in their community. Alongside these activities, communities also work to distribute campaign materials like those posters, fact sheets, videos, things I showed earlier, both in person and online. Additionally, a geographically targeted paid advertising campaign was used to increase reach in each community. And so the exact platforms used varied based on community and audience, but generally included things like social media and online ads, traditional media like TV and radio, and some digital out-of-home placements. Community-wide campaigns like Move Your Way are one of the many recommended resources and strategies included in CDC's Active People, Healthy Nation initiative, and they're also recommended by the Community Guide. In addition to the activities listed on this slide and in our community playbook, we really encourage communities who are implementing Move Your Way to use resources like Active People, Healthy Nation and the Community Guide to brainstorm other effective strategies and activities that can be implemented alongside their Move Your Way promotion. So now that you have an idea of what implementation looks like at a high level, I'm delighted to turn it over to Marcel to kick us off with our local implementation.
Thank you, Kate. Next slide, please. So like Kate said, my name is Marcel and I work at the Cabarrus Health Alliance in Cabarrus County, North Carolina, right outside of Charlotte, Mecklenburg. And our total population is about 216,000 people. I think with the new census, we're at about 225. And within our effort, so we were a 2020 pilot site for Move Your Way. Our priority campaign population was the physical activity contemplators. So one of the things that we did for our project is actually partnered with a local walking initiative that was led out of a local coalition called Walk Cabarrus. And so we wanted to co-brand materials and really integrate the Move Your Way messaging into an existing platform of how we were engaging our community in physical activity. Next slide, please. So one of the things, Walk Cabarrus was a community-wide walking campaign that we launched right before the COVID-19 pandemic started back in March of 2020. And it was really about getting people out and engaged in physical activity. And so the Move Your Way opportunity to be a pilot site was just really helped us streamline and really helped us ensure that we were educating the public with founded evidence and recommendations on physical activity levels. So we were able to co-brand the materials, which meant that our population who had been seeing Walk Cabarrus wasn't feeling like there was a new campaign or a new initiative, that they really integrated into one another, and Move Your Way helps support really that educational side of physical activity. We were able to localize the message, so people felt like it was something they already knew and it was something they could be a part of. So Walk Cabarrus really targeted those walking contemplators or physical activity contemplators, utilizing the Move Your Way messages, and people got to see themselves in it at times. You can see a social media post there from Walk Cabarrus right there on the right, using the Move Your Way messaging. And then really it was a trusted source of education. So people were sharing the message because they were a part of Walk Cabarrus. They had signed up to track their steps through an online portal, and then were constantly being presented with information from Move Your Way as well. Next slide, please. So as a pilot community, we were really excited that we were going to kick off with this large community event. We have a new baseball field across the street, and we were going to have someone from Move Your Way throughout the first pitch, or for ODPHP to throw out the first pitch of the game. But obviously COVID threw a wrench in many of our plans for 2020 and 2021. So we moved to the virtual world, and we really embraced that. So we held giveaways online through Facebook and through Instagram. And you can see there on the right, we had a bingo card. So people really embraced Walk Cabarrus and Move Your Way at the time, when we were really encouraging people to isolate and not engage with others, but being outside was kind of everyone's resource at the time for their mental wellness and physical wellness, since they weren't going to the gym or things like that. So this bingo card was really an opportunity for families to get out, to engage in different physical activity opportunities. They were encouraged to share it online and show what they did, and they were incentivized for that. We also delivered swag bags. So initially we had the hope to engage in existing community events with a resource table, providing education about Move Your Way and Walk Cabarrus. Again, COVID threw that wrench in there. And so we had community champions in 12 different neighborhoods in our community, and they went door to door and just left them on people's door as a door hanger, with giveaways, with incentives, information from Move Your Way about physical activity levels and ways to start being active. And so they were actually able to go to 2,400 different households and drop those off. But again, just finding a way to engage our population, share messages with them that made physical activity feel easy and achievable to them was a huge piece of what we were able to do through the Move Your Way campaign. So at this time, I'd like to pass it over to Mindy Meacham.
Hey everyone, I'm Mindy Meacham, a health educator at the Southern Nevada Health District. The health district serves over 2 million residents living in Southern Nevada, which represents 72% of Nevada's total population. And for a point of reference, we're located in Las Vegas. We've participated in the Move Your Way pilot program twice. In 2019, we focused on audiences that are at greater risk for physical activity health disparities. And then in 2021, we returned specifically to use the Muévete a tu manera, the Spanish version of the campaign, to reach Spanish-speaking parents and families in our community. Next slide. One of the great things about the Move Your Way campaign is the availability of Spanish resources. Using the Muévete a tu manera campaign materials, we were able to distribute Spanish posters and fact sheets. It's not always easy to find resources in Spanish, so we really appreciated having access to Spanish language physical activity resources. And the added benefit is that being able to download them and then print them as needed. These materials really complemented our Move Your Way Spanish language events and activities. We held several virtual fitness classes for families led by 2 popular Latina women who were personal trainers. We had a virtual Walk with a Doc event that connected community members with a Spanish-speaking pediatrician. We also participated in a large Cinco de Mayo event to encourage physical activity. And then our promotoras hosted fitness classes in the park. And then we also had a big Move Your Way day out at the pool at a local rec center. We were also able to use our Spanish social media graphics and messages on our Spanish website and social media channels. The health district has a Spanish language website and a Facebook called Viva Saludable. So the Spanish campaign graphics and the messages really allowed us to seamlessly incorporate the Move Your Way content into our already existing posting schedule. Next slide. The success of our campaign is tied to our partnerships in the community. In both 2019 and 2021, we connected with multiple community organizations with expertise and familiarity with our audience, and that really was key to being able to reach our audiences. Our partners came from all different sectors, including Parks and Rec, churches, healthcare, promotoras, elected officials. These partners assisted us with planning and promotion, and then some of them even hosted some of our Move Your Way events. Several of our partnerships were new, and this campaign provided an opportunity for us to develop those new relationships and work together on similar goals. By creating these new partnerships, we've expanded our reach and connected to the community in different ways. So it's been a really good thing for us. We really did find that our partnerships were the key to the success of our overall campaign. We feel fortunate that we were able to participate and Move Your Way in the Move Your Way campaign twice, and we look forward to continuing this work in the future. Now I'm going to turn the time over to Michelle Lewis.
All right, thanks, Mindy. My name is Michelle Lewis, and I am the Health Promotion and Planning Coordinator at Siouxland District Health Department in Woodbury County, Iowa. And so our county is roughly 103,000 individuals. We're located in the northwest corner, and we had the privilege of participating in the pilot program twice, so in 2020 and 2021. The first year, we focused on our general population, the physical activity contemplators, just families and children. And in the second year, we focused on a subpopulation of our pregnant individuals and recently birthed mothers. So next slide, please. So during the course of our 2 years, we really focused on utilizing the built environment or structures that we already had in place. And again, COVID had hit, so we were looking at more outdoor places that people could kind of spread out and utilize. So the first photo there on the left-hand side is the Move Your Way yard sign. We had several of these yard signs made that we used for a variety of our initiatives, but this particular one was a scavenger hunt. So each week we put several of our yard signs along a different trail in our community, and we had several trails. And we just encouraged people to go out and find the trail that the signs were posted at, and then they would take a picture, upload that picture to our social media page, and it was just kind of a fun event for people to get involved in. On the far right picture is one of our local disc golf courses that we encourage people to get out and be active in. So we partnered with our local radio station that kind of aired some of the Move Your Way messages, and then also made available the Frisbees at their office for people to come and pick up at the radio station. We also had them here available at the health department to pick up as well. The same premise, we encourage them to go out, play the disc golf, snap a photo of themselves, and then upload it to our social media site. And then also with our trails, we did a variety of signage. So we have Bacon Creek is one of our most popular trails. However, the mileage sign markers were kind of getting a little deteriorated. So we purchased and developed some new miles signage that not only included the miles that they had left to walk, but also the minutes that they had to walk. Again, when we're working with contemplators, they may not necessarily know how long is a mile or how long is a 2-mile path in town. They can maybe relate more to, okay, I only have 10 minutes or this is a 20-minute walk. So we had a lot of those signs put up around Bacon Creek. The stencils were also very popular. They, again, mark the mile markers around different trails, but also just Move Your Way logo and imagery so that people could just continue to see the Move Your Way messages. And then we also developed a park bench workout sign that we had put up on a variety of trails and then some of our playgrounds so that people know, again, that they can, in addition to being cardiovascularly active, also do some strength building exercises, but all you need is a simple bench to do that. So again, utilizing the tools and the facilities that you already have in your community is something to think about. Next slide, please. Then partners. We couldn't have done the program without partners. Our first year, we were able to do our large kickoff. Prior to COVID, we did a winter park festival. We held it at one of our snow tubing facilities. One of our local clubs, our Sertoma Club, does a cardboard snow kind of race every year. So we partnered with them and then expanded it into a big winter festival. So we pulled in different YMCAs, hospitals, and other organizations that also had activities there. We had snowshoeing demonstrations, we had snow making relays, that type of thing. And then we also had our local ice hockey team, the Musketeers, come and kind of take pictures and sign autographs. So again, it was all about partnering with individuals to kind of make a fun event. Then in the second year, we really were focusing, like I said, on that maternal health population. And so we transitioned to working with our local OBGYN offices, our birthing hospital, our local women, infant and children program and HOPES programs to allow them to get our messaging to those individuals. We created a Move Your Way binder. You can see there in the photo. We put a lot of the fact sheets in there that were already created for us. And then we had a nice kind of workout bag that we stuffed it in. We had the Move Your Way exercise bands and some Frisbees. We actually had some onesies made with the Move Your Way logo on it. Everything to kind of draw attention to the information that these individuals may have been getting at their doctor's office and or at the hospital. So again, we couldn't do it without partners, and it just kind of helps the program go more smoother. And now I'm going to turn it over to Mary Kate.
Thanks, Michelle. Hi, everyone. My name is Mary Kate Crawford, and I'm the Associate Director for Programs within University of Maryland University Recreation and Wellness. The University of Maryland is located in College Park, Maryland, just outside of Washington, D.C. Our campus serves over 30,000 undergraduate students and just about 10,000 graduate students. University Recreation and Wellness, or RecWell, housed within our Division of Student Affairs, is comprised of 45 full-time professional staff and nearly 800 student employees. We manage over 400,000 square feet of indoor rec space and over 200 acres of outdoor space. In addition to the facilities we support, our department also promotes offerings such as intramural sports, group fitness, outdoor recreation, and aquatics programming. It is our mission to enrich the educational experience and encourage personal growth by inspiring our university community to be active and live well. I'm excited to be here today and share our experience with this campaign. Unlike the other speakers, we were not one of the pilot organizations, but we did work with ODPHP directly to support our campus community. Each year, we set out to tailor our social marketing campaign to meet the needs of our campus community. When the new physical activity guidelines were published in 2018, we knew sharing those updates with our students was essential, and the Move Your Way campaign made it easy to do so. In early 2019, we reached out and established a relationship with ODPHP, and this relationship allowed us to utilize the Move Your Way campaign tools and customize the materials to reach our priority population, college students. Next slide, please. To launch our campaign on campus, we provided Move Your Way campaign information at various Recwell activities like intramural sports games, group fitness classes, and other events around campus. We handed out fact sheets, stickers, and buttons to our participants and our employees. All of our Recwell professional staff and student employees received the training about the campaign and the key messages so that they could help promote the idea that physical activity doesn't have to happen in a specific place like one of our recreation centers or look a certain way. In an effort to share the messages in as many places as possible, we also hung customized Move Your Way posters in residence halls across campus, and we were able to place advertisements on the campus bus fleet. We utilized our social media accounts to further reinforce the messages that students were seeing across campus. The post you see here is an example of how we tied the Move Your Way messaging to existing offerings like our robust club sports program. Next slide, please. In 2020, for the second iteration of our Move Your Way social marketing campaign, we focused on 4 specific benefits that are top of mind for college students: sleep, focus, mood, and stress. This version of the marketing campaign was designed to help students make connections between physical activity and their everyday life. As Kate previously mentioned, we know that college students are less likely to be motivated by the promise of long-term benefits like disease prevention, and instead more likely to be motivated by opportunities to improve their academic performance, reduce stress, and most importantly, get more sleep. Today at Recwell, we continue to use the Move Your Way theme and messaging through all our communication and marketing efforts. The campaign's key messages were bite-sized, tangible, and directly related to our students' lives. We incorporate Move Your Way messages like lots of things count, it all adds up, and physical activity can make you feel better right away into all our work and presentations around campus. This messaging was more relevant than ever as we support it and continues to support our campus community through the pandemic. Student mental health is a top priority on our campus, and we've used the Move Your Way campaign to inform our collaborative efforts with our on-campus counseling center. For example, we recently launched a pilot program where counselors are able to refer students struggling with their mental well-being for free personal training sessions. The Move Your Way campaign gave us the language we needed to advocate it for that partnership. I'll now turn it back to Kate.
Thanks, Mary Kate and Marcella and Mindy and Michelle. It was really, really wonderful to hear how you were able to incorporate Move Your Way into your community efforts and interesting and creative ways that you made the campaign your own. In this last portion of the webinar before the Q&A, I want to share some important resources that anyone listening can use to support similar efforts in your community. The Move Your Way Community Playbook is the implementation guide for the campaign. So in the playbook, which is located on health.gov, You'll find tips to help implement the campaign, like how to connect with local partners or find new ways to collaborate, how to secure funding or leverage existing community resources, how to engage with community members through events or social media activities, and also some tips for how to evaluate activities so that you can improve your future initiatives. The playbook is split into 2 phases. In the first phase, it walks through all the steps involved in planning and strategy development. So during this phase, either a small campaign team or an individual would oversee the planning process, decide what types of activities you want to pursue locally, delegate tasks, secure funding. Parts of the playbook in this phase give information about how others have used the campaign. So there is a check out Move Your Way pilot communities section or a brainstorm implementation strategies section, which can really help you to understand and find some examples of what might work for you. The second phase of the playbook focuses on the activities and promotion that actually happens during the implementation. So it's the get stuff done phase, and then to evaluate those activities. So during this phase, the campaign team or the individual in charge is going to help to oversee the events and materials distribution, to work with partners collaboratively, and to make sure that evaluation efforts stay on track. Throughout the playbook, you'll also find links to PDF resources. And these PDF resources are things like tip sheets, a sample pitch language, a budget, and more. One of the great things about the playbook is that you can use the whole resource from beginning to end, or you can take the very specific pieces that would be most helpful to you and your team. So for example, if you've got somebody new on your team and they need to talk to a funder and they're looking for, what do I need to say about Move Your Way? You can quickly grab the campaign talking points PDF and just share that with them directly. The playbook was developed to help community organizations use Move Your Way to enhance local physical activity initiatives. So we developed this resource with the help of all the community pilots that we've worked with, like those you heard from today, but we also tested the playbook. And so we've conducted in-depth interviews and some online usability testing with people to ensure that the playbook is relevant, helpful, and easy to understand, regardless of how familiar someone is with the campaign or how much physical activity programming they've done in the past. Over the years, we've continued to add new resources and update content based on the feedback that we got during testing and the experiences of the pilots. And so this is a resource that we consider a living resource that will continue to improve and expand along with the campaign. So now that you've heard all the great things that communities have done and seen the community playbook, how can you get involved? So as you've seen, Move Your Way, both the campaign resources and the implementation strategies are designed to be adaptable. So we at HHS might be the experts in the physical activity guidelines, but we know that there's no one who knows the ins and outs of your community more than you do and of your audiences. You know your local strengths and challenges, you know who you need to talk to, and if you don't, then your partners do. And so you're in the best position to tailor the activities and the efforts that'll help you be the most successful in your community. Move Your Way implementation is also really adaptable based on the resources that you might have. Any size team or any size budget, any size community can take pieces of Move Your Way and make it work for you. So you're able to really implement your way. If you're thinking about what elements would be best in your community, and you're not sure how they would adapt, like for example, if you don't have the time or the money to do a big event, you can use the free ready-made materials. If you're not sure how to engage partners, we have a tip sheet for that. If you're interested in customizing, you can use the CDC Media Center. So there's just lots of different ways that Move Your Way can look. Next slide. To learn more about the Move Your Way campaign, there's 3 primary links that you can take a look at. The first is where you can find the full range of Move Your Way materials and resources. And this is specifically where people who are looking to implement the campaign should go. If you're interested in jumping directly into that community playbook resource that I mentioned, that second link will help meet the implementation needs. And then finally, if you're interested in checking out Move Your Way through the lens of a community member or an audience member, you can visit the campaign microsite that's designed just for consumers, and that's at health.gov/moveyourway. If you want to use the materials as they are now, as they were on the screens earlier, you can do so easily from health.gov. That's where you can go and download them. They're ready to go, ready to print, ready to share, etc. But if you want to customize the materials further, you're actually going to visit the CDC State and Community Health Media Center. And so the Media Center is a great resource. It's a collection of free and low cost audience tested advertising and support materials. And it's also a place where you can go to view and download a variety of physical activity photos. Through the Media Center, you can customize Move Your Way materials to add your organization's logo, or by updating the photo to include an audience demographic or a particular type of environment that you might want to highlight. I will note that there is a small fee associated with the customization, and we recommend that you give yourself about 2 weeks to make sure that you can make an account, get the paperwork done, and then get your materials. The Media Center staff are also available for free consultations, and they can give help with answering questions about how to use the website, finding the Move Your Way material that might work best for you, or placing an order. And so on the slide, you'll see an email address where you can direct questions or schedule a free consultation. The biggest thing I want to emphasize as we wrap up today is that you don't have to take on Move Your Way on your own. We want to be involved and we want to help you along the way. There are several ways that you can stay in touch with the HHS Move Your Way team. You can follow ODPHP on Twitter and Facebook. You can also sign up for our email listserv on health.gov as a way to stay up to date with the latest campaign developments. And there's the URL there, and there's also a picture of where you'll find the sign up for email updates. And then finally, if you have a really specific question or want to reach out to our team directly, you can use the Contact Us page on health.gov, and you just select Move Your Way in the subject drop down, and then that message will come directly to us. All right, and I think, yep, perfect.
Now we'll take about 10 minutes to answer some of the questions that were submitted throughout the presentation this afternoon. We received a lot of questions today, so we'll get through as many as we can in our remaining time. And don't worry if we don't get to your question. We'll develop a question and answer style blog post or reach out to you directly if it's something specific to your community. If you forgot to ask your question, feel free to submit those in the Q&A chat now. And so we'll kick off with this first question addressed to Marcella. And so this is specifically thinking about the Physical Activity Initiative and Walk Comparis. And so the question reads, how did you manage the sign up to track the steps?
Yeah, so that was actually a project completed prior to our relationship with Move Your Way, but we contracted with a local marketing company that created the website and the platform for us. So if you go to Walk Comparis, you'll see some of the messaging, but you'll also see the option where participants could create an account and then log their steps. And it also linked back to Fitbits so that we had leaderboards and things like that. But that was done outside of the Move Your Way, but Move Your Way really helped to show people other ways that they could get those steps. And it even pushed us to do some like walking your pet or your family or even rolling and things like that, and how we could track that as well.
Thanks, Marcella. Our next question is addressed to Kate, and it reads, were you able to do any evaluation of these materials towards disease prevention and health promotion?
Thanks for that question. We were able to do a large scale evaluation in our communities in 2020, where we fielded an online survey to understand people's physical activity behavior, their self-efficacy, and we are still working on pulling together some of the findings from that. What we've seen so far are really promising, and we actually hope to be able to highlight some of that in another webinar later this year. So if you're able to join our listserv, we'll be sure to share more information as soon as we're able to kind of go through those findings in more detail.
Thanks, Kate. And so our next question here is addressed to Michelle, and it reads, can you talk about any of the partnerships with primary care?
Sure. So primarily we focused with the, like I said, the OBGYN offices when we were working on a maternal health focus group, excuse me, population. And then the WIC, or Women, Infant, and Children, and then our birthing hospitals. So again, we were geared towards those that were pregnant and are just recently postpartum. So we did not necessarily work out or reach out to our primary care physicians or family practice physicians, but mainly those that see clients that were pregnant.
Thanks, Michelle. And so I see a few questions coming in on the chat with regards to, sorry, Kate, go ahead.
I'm just going to add one more thing about healthcare providers, if you don't mind, Joshua.
Sure.
In a lot of our early research, we saw that healthcare providers are a really trusted source of health information, especially information related to physical activity. But we also know that healthcare providers before the pandemic, and even more so now during the pandemic, they've got a lot of things on their plate. There's a lot of topics that they're needing to cover, things that they're needing to discuss in a very short time for a lot of patient visits. And so there are a few Move Your Way resources that are designed specifically for healthcare providers that help give tips and recommendations on how they can weave in physical activity to some of their conversations and how they can help patients to address some of their common concerns and barriers. So this is something that Michelle's team was able to do very well within the maternal health audience, but we know that it's not limited to just that, and that lots of people find healthcare providers to be a really great source of information. And so if you do work for a healthcare company, or if you work with healthcare providers, you might want to check out those healthcare provider specific resources. Looks like, yeah. Thanks.
Mary Kate, did you have your hand raised?
Sorry, it was an accident.
No problem. And so my next question here is actually posed to any of the panelists that may have an answer to this. And so it reads, could any of the panelists speak to how they engage community health workers in promoting Move Your Way? Marcella.
Yeah, I'm happy to talk a little bit about that. So it's going to kind of answer the question, but we haven't done it just yet. So we have just received a CDC grant where we have 6 community health workers at our health department. And so one thing that we're hoping to do is have them help to engage, especially some of our lower income populations, which I saw that coming into play as well, because during COVID, we weren't able to reach as many people as we would like to have reached and engaged in this. So we're definitely looking at our community health workers that are deployed within our community free clinic, one of our FQHCs, a couple of nonprofits in DHS to help share this message in the communities that they're focusing with. So hopefully we can share some of that feedback back to ODPHP and the Move Your Way folks about the impact that that's had on increasing the reach among populations that we're focused on with the Community Health Worker Initiative.
Thanks for sharing, Marcella. Mindy.
This is Mindy. We have a community health worker in our office. So I was fortunate to be able to use her to work on the Move Your Way campaign. So one thing that we did, during the pandemic, things were a little bit crazy. So we put together a list of local agencies and organizations that we wanted to have the Move Your Way resources. And we put together a whole list of who we would like to have these resources. And then she went and delivered resources directly to each of the organizations, made connections, spoke with them about, you know, the pilot project that we were doing, and then talked about any events that were coming up. So she really did a great job of like reaching out one-on-one to some of those organizations. And then also our community health worker participated in helping us to, you know, work the event and to do any of the promotion side of things, helping us man the table and get our resources out to people. So that was a vital help for us, having that community health worker. So I just wanted to.
Thanks, Mindy and Marcella. So I think one more question that we'll be able to take here is addressed to Marcella with regards to the bingo card. And it seems we have some interest about whether that's available online to take a look at.
I'm gonna have to double check. If it is not, I will send it to Michaela or Kate and ask, and it can be shared and definitely used by other communities. It was a fun way for parents and kids to do it together. And we actually had stops in the community where we were set up virtually for folks to come out and see kind of what was going on. So I'd be happy to share that tool.
Thank you. And now I'd like to turn it back over to Kate.
Oh, thanks, Joshua. I will tag real quick a couple of the questions. I saw a few people put in the chat asking about future translations. And we definitely recognize that there are communities that are looking for easy ways to communicate with a variety of different audiences and people speaking a variety of languages. Right now, at this point, we only have the materials available in English and Spanish. But definitely feel free to reach out to us and let us know what languages would be top priority for you and your community. Having that information is really helpful as we make future decisions about kind of where the campaign is going to go next, and having that information is really important. So we appreciate that. We will be making a recording of today's session available online. So there was a few questions about that. For those who are interested in learning more or establishing a relationship with us, please feel free, Michaela, if you can go back a few slides to the ways to contact us. You know, any of those, I think it's forward a few. There you go, perfect, right there. Any of these ways are great ways to reach out to us, and we'll be sure to contact you. And then I also saw a few questions about funding. There were the pilot organizations who participated with us did get some financial support in doing these activities, but we also made sure in our community playbook to be able to highlight some low cost or free ways that you'd be able to implement the campaign. We recognize this is a big barrier for folks and are currently internally figuring out some ways and methods that we might be able to help with that in the future. But we do call out some areas in the playbook that can help with that as well. Let me see if we have any other questions. Let's see. All right. It looks like that might be the questions that we have today. I'll give it a minute or two just to see if any others come in at the last minute. We hope that you enjoyed today's session. Thank you again to all of our communities and university partners who were able to join and be able to share their great work. I will note that if you do visit health.gov and search Move Your Way, we have highlighted all of our participating pilot organizations have had a blog post that's focused on their work. So for those who we weren't able to squeeze into our hour today, great efforts going on in a lot of different communities, a lot of different size communities and audiences. So I encourage you to take a look there as well to see more information. And for those asking about future resources, we will be sure, as Joshua mentioned, to create a blog post that can highlight some of these frequently asked questions and make sure that you get all the links to the resources. Oh, I see one last question that I will call out to our communities, and I'm not sure anybody here has, but the question is, has Move Your Way been partnered with or implemented in any faith communities? So I'm not sure if any of our panelists today have done anything with faith-based groups. Okay, I know that many resources promoting physical activity, including important partnerships in sectors like those highlighted in Active People, Healthy Nation from CDC, or other sector-based physical activity work, often recommend partnering with faith-based institutions, as they can be, like healthcare providers, a really important and trusted source of information and community building. And so that's a great point from the person who asked the question. And if that is something that you are interested in, we would love to see what you're able to do with the campaign and potentially highlight your work in the future. So I think I will wrap it up there, but thank you very much for joining, and we look forward to engaging with you in the future.